There has been a lot of talk about potential tariffs, but the U.S. is not just important to Canada when it comes to trade. We are also connected to our neighbor when it comes to health. From spreading diseases across the border to sharing vaccines and information, the politics of health in the States can affect us right here in Saskatchewan. And right now, the U.S. is not sharing essential seasonal flu data with the World Health Organization ahead of a key vaccine meeting next week. It's something of concern to Angela Rasmussen. She is a scientist at the Vaccine and Infectious Disease Organization at the University of Saskatchewan. Good morning, Angela.
Good morning. Thanks so much for having me.
Thanks for being here. Can you catch us up on what will be happening at the World Health Organization meeting?
Yeah, so twice a year, folks from around the world get together at these meetings, and there's one in the fall, and there's one at this time of year in February. The February meeting is to decide which strains are going to be used for the upcoming seasonal flu vaccines in the Northern Hemisphere. The one that happens in August or September does the same thing, except for vaccines in the Southern Hemisphere. And picking these vaccine strains, so that every flu vaccine is made up of usually 3 or 4 different influenza viruses to provide you with protection against all of those viruses, because we think that they're going to be the predominant ones circulating in the next flu season. So it's really, really important that all these countries get together to select these strains, because they do that based on where these different flu strains have been circulating, what strains they think are going to be dominant coming into that next upcoming flu season. And that's all based on surveillance data from all of these different countries that participate in this process. And what's happened now is because of the executive order that President Trump issued withdrawing the United States from the World Health Organization, the CDC, the Centers for Disease Control and Prevention in Atlanta, who run all of the United States' flu surveillance programs, are not going to be able to attend this meeting. And therefore, all of that flu surveillance data that they've collected will not be able to be included in the decision-making process for which vaccine strains are going to be selected for this upcoming year, the 2025 Northern Hemisphere influenza season in the U.S.
What could the consequences be then on the average person in the United States of the U.S. not having a seat at this table?
Yeah, so the consequences are going to be pretty severe, not just for the U.S., but for every country in North America, and that includes Canada. And what these consequences are is that they're just not going to be able to select flu strains as accurately as they have in the past for the vaccine, because they're not going to have access to all of that U.S. flu surveillance data. And yes, they will have access to Canadian data. They will have access to data from Mexico. But the United States is the most populous country in North America, with a much larger population than either Canada or Mexico. So it's really important for all North American vaccine formulations to include data from the U.S., because that's where the majority of flu is spreading, just because there's more Americans than anybody else in North America. So it's gonna have consequences in terms of the flu vaccines that will be available in the upcoming flu season. Will probably not be as well matched as they could have been. They're going to be less effective, and ultimately that might drive down flu vaccine uptake in the U.S., Canada, and Mexico, and potentially elsewhere, because people will think, what's the point? Like, these vaccines don't work very well. And it should be mentioned that the vaccines are not perfect. From year to year, the vaccines sometimes are not well matched, but it's really important to note that even when they're not perfectly matched, they still provide some degree of protection against influenza and severe influenza. And it should be noted that about 650,000 people die worldwide every year from seasonal flu. So having a vaccine that is as protective as possible is really important. And the people of North America, and potentially in other continents as well, will not have that advantage, because we're going to be missing all of that U.S. flu surveillance data.
What trend are you seeing in official messaging about health issues in the States otherwise?
Well, that's a tough question, because so I'm American originally. I moved to Canada 4 years ago. And so I'm very on top of what people are talking about and doing in the U.S. And while my colleagues and my family members and the people that I know in the U.S. are still they're following the science. They're asking me, like, what's going on. My colleagues who are scientists are obviously saying the same thing that they were saying 6 months ago. But everybody's really, really concerned because the messages coming from the government are that we are antagonistic towards healthcare. We're antagonistic towards healthcare research. The recent firings across the federal government, and particularly within the Department of Health and Human Services, have really gutted American capacity to respond to influenza emergencies, including potentially an H5N1 bird flu pandemic or epidemic. And the overall message that we're getting from the government is that we're going to take apart our ability to respond and to do research on influenza, and we are not prioritizing American healthcare. And that's really terrifying because in my entire life growing up in the US, I never imagined that the Centers for Disease Control and Prevention, the National Institutes of Health, the Food and Drug Administration, the US Department of Agriculture, that any of these organizations would be opposed to great public health measures or opposed to vaccination. But those are the messages that we are getting from the people who are currently in charge in the Trump administration.
What kind of harm could that do here, some of this messaging trickling in? What kind of harm could it do?
Well, in Canada, I mean, there certainly is a contingent of folks who have been susceptible to the Canadian version of some of the misinformation that has been spread. And I think the Freedom Convoy, the trucker convoy, is a great example of that. Calls for medical freedom and things like that are really actually anti-vaccine positions. And that certainly has already made its way to Canada. But I think overall, I'm sort of encouraged because the U.S. has been so aggressive towards Canada, despite our longtime friendship between our two countries, that I think Canadians are actually going to be a little bit less susceptible to it coming from the U.S. simply because the U.S. has policy-wise been doing everything in its power to alienate Canadians and to claim that the U.S. is going to annex Canada, that we're going to be the 51st state. I think most Canadians are not very receptive to that. I'm certainly not receptive to that as an American who lives in Canada. And I think that will actually help Canadians be a little more resilient to some of the misinformation that we're seeing coming from our neighbors to the south.
You mentioned the bird flu a moment ago, and I do want to talk about that because it is a big concern right now in Canada, but even more so in the U.S. So what is the latest on avian flu?
Oh boy, this is kind of a long question, so I'm going to try to make it short. But the situation in the U.S. is actually quite risky and dangerous, and it is developing every day, essentially. So let me just kind of lay out the landscape for you. Last March in 2024, it was reported that a farm in Texas had H5N1 in dairy cows. And within a week, we identified the first human infection in a dairy worker. And then we went on to realize that this dairy cattle outbreak has spread to multiple states, many of which are not next to each other. From there, we continued testing, and the USDA is still carrying out its testing program. Now we have almost 1,000 infected herds of dairy cattle in the U.S. Some of these herds, by the way, are thousands and thousands of cows in 17 states, and we're still finding new detections. And disturbingly, about over the last 2 weeks, we've identified 2 additional spillovers from birds to cows of H5N1. Initially, we thought that there had only been 1 spillover from birds to cows and that this was actually a fairly rare event that ended up spreading because it wasn't detected for so long and there wasn't adequate containment applied. But now we know that it's actually happening more frequently. And as we continue to test milk, I suspect that we are going to find new herds in new states, potentially infected with viruses that have spilled over uniquely into them. At the same time, H5N1 is everywhere in wild birds, and this is a problem for both the U.S. and Canada because that means that we're seeing an uptick in the number of poultry operations, everything from large factory farms in the U.S. that have millions of chickens to backyard producers who might have a few chickens that that live in their yard or their home family farm. And so this has caused the death of millions of birds. Over 100 million birds have been culled in the United States because of the increasing frequency of these spillovers from wild birds into poultry operations. So it's a huge economic problem and a food security problem in terms of dairy, as well as poultry and eggs. And many people in the US have been talking nonstop about the egg prices. And the egg prices are so high simply because when a flock of like 1.2 million chickens, for example, is culled, you have to replace those chickens, and those chickens come from eggs. And now there's not enough eggs because also layer flocks, the flocks that produce eggs, are also being culled because they're also getting infected with H5N1. And what's so dangerous about all of this, I mean, again, it's a huge economic and agricultural and food security problem. But what is really so dangerous is the risk of a pandemic. And I am very, very concerned about that because over the last 6 months, we've seen the number of human cases in the US absolutely explode. Now we've seen that there have been 3 different severe cases caused by both major circulating genotypes of the virus, which means that basically all the viruses around here have the potential of putting people in the hospital or potentially killing them. And we saw the teenager in BC in November who was very, very ill, and it's frankly very lucky to have survived. And so the number of human cases accelerating is a huge problem for that, but also for another reason. So right now, we don't have any evidence that this virus has acquired the ability to spread from person to person. And that is why the risk to the general public is considered low, because right now, all of the cases of H5N1 that are occurring are through exposure to animals, and it's not spreading outward into the human population. However, influenza can do this thing called reassortment, which is basically the genome of the virus is divided into 8 pieces. And when 2 influenza viruses infect the same host, those 8 pieces can get mixed up and packaged into the new viruses that are being made. And this is called a reassortant virus. 3 out of the last 4 flu pandemics have been caused by reassortants with a human seasonal strain. Right now, it is flu season, and flu cases are peaking in the US. That's mostly H1N1 and H3N2 subtypes of human adapted seasonal flu. If we have all these humans who are infected with H5N1 and they get the seasonal flu that's already adapted to humans, these 2 viruses can mix up and make a reassortant that potentially could transmit from human to human because the seasonal viruses do that very well. So right now there is a patient who is severely ill, was infected with backyard chickens in Wyoming and was hospitalized in Colorado at the same time that hospitals are absolutely full of seasonal flu patients. So this is a huge risk. And over the next month or 2, I'm very concerned that reassortment could occur, and that would lead to potentially a flu pandemic. And another reason why I'm very, very concerned is actually not a virology reason, but because of the cuts in the US federal government, because the government has been so hostile towards a proactive public health response, and they're not doing as much surveillance, and they're eliminating many of the jobs that would investigate such an outbreak. I'm not sure that we're going to have the capacity to even recognize human-to-human transmission if it begins.
Oh, wow.
And if that happens, there were delays in detecting human-to-human spread of COVID in early 2020, and that delayed the U.S.'s response by probably 3 to 4 weeks. In this case, it could delay it for potentially longer. And honestly, my biggest fear that keeps me up at night is that we won't know that it has acquired the ability to transmit human to human until so many people have been infected that small percentage that's going to get severely ill starts showing up at the hospital, overwhelming the hospitals. By then, it will be too late because so many people will have been infected. The primary cluster of cases will have expanded to the point that we can no longer contain it. And that's a bird flu pandemic. So I'm gravely concerned about the changes that have occurred in the US because that's where this is likely to happen with so many human cases and so much seasonal flu around. I lose sleep thinking about what's going to happen if we do start to see those patients showing up at the hospital. It's going to be worse than COVID, and I'm very scared actually about the U.S.'s capacity to respond at all. That affects Canada, it affects Mexico, it affects every other country in the world, and it would be an absolute catastrophe.
It's really, really concerning to hear you talk about this, Angela. As a research scientist, as a virologist, what are you going to be watching for in the U.S. over the next few months, just before we let you go here?
Yeah, so that's a great question. I'm currently looking closely at the flu surveillance data, which for now, anyways, is still being published by the CDC. And today, actually, they're probably this afternoon, they'll post, or they should post the most recent flu data. What I hope to see is that seasonal flu cases are declining. Last week there was a slight decline, but levels are very, very high still. So I'd like to see the trend continue to decline, because the lower the amount of seasonal flu in the human population in the US, the lower the risk of reassortment. So I'm going to be watching very carefully the seasonal flu trends. And then, of course, I'm going to be looking out for any new information about more infected herds of cows, more poultry infections, and then, of course, more human infections.
Angela, I really appreciate your work and your time this morning. Thank you.
Oh, it's my pleasure. Thanks for having me.